Hello, everyone. My name is Dr. Miriam McParland, and I am here to talk to you about how to get better faster. If you're viewing this, you are already a patient, and we are going to take you to the next step and next level of improving your health so you can decrease your pain and also improve your overall health. So I am a chiropractic physician. I'm also certified as a wellness practitioner, and I hold certifications in women and children's health and rehab. With that being said, let's get started. So the Better Faster workshop, we will discuss reasons why you have pain and dysfunction, dis-ease, which is disease, why it causes you dis-ease and you develop some symptoms, and how to improve your health naturally. We will also review different things that you can do at home that will help you get better faster. And we can address diet, supplements, stretches, and we'll also go over some home care. And now this you can also use with your family. So the definition of disease is a condition of a living animal or plant body or of one of its parts that impairs normal functioning and is typically manifested by distinguishing signs or symptoms. So if you're experiencing any sign or symptom, that's your fire alarm to let you know to get checked and to address whatever is causing that symptom. The symptom is a reflection of the cause. It's not the cause, okay? So what causes disease? It's your body's inability to adapt to the environmental changes and the demands that are placed upon it, causing either deficiencies or excessive loads. So you're either getting too much of something that your body doesn't need or too little, like you're not getting enough nutrient-rich foods. So inside the numbers, I'd like to go over some of the reasons where we're headed and where our healthcare system is. The largest expense to Americans over the age of 65 is healthcare costs, not a mortgage or not insurance. 70% of healthcare expenses for all Americans are on lifestyle conditions and chronic diseases such as heart disease, diabetes, obesity, stress, chronic pain. Number one reason people visit doctors is due to back pain. And then, of course, there's adverse reactions to drugs. America consumes 80% of the world's medication, which is about 4.6% of the world's population. And we make up 4.6% of the world's population, and we consume about 80%. I think that number has actually gone up, which is, in my book, not a good thing. 45% of Americans suffer from chronic pain and conditions. 50% of all bankruptcies in America are due to excessive medical bills. So what you want to start doing is just start to say no to popping pills. So instead of taking NSAIDs all the time for NSAIDs can cause GI complications. They can increase your risk for kidney disease, increase your risk for liver disease. 504 billion yearly economic costs are due to painkillers and opioid use. It increases your risk for cancer as well. Lifetime, I believe, for use of NSAIDs like ibuprofen, I think it's like lifetime use is $1,200 per lifetime. I know people who take that in like a year. So what causes disease? There's three factors that cause disease. Those are chemical, they're emotional, or structural. So toxins, deficiencies can cause diseases. So deficiencies, such as if you're starving, it's not so much you're starving because you're not getting enough food. You can get plenty of food, but if they're nutrient deficient, then you're starving for nutrients, macronutrients, micronutrients. So there's difference between eating a salad and a cheeseburger nutrient-wise. You get more of what your body needs from a salad than from a cheeseburger. Dehydration. So dehydration is the lack of water. So you need to make sure you're consuming plenty of water. Suffocation. That's lack of oxygen. So making sure that you're breathing in good quality oxygen. And subluxation. That is lack of nerve supply. When you have subluxations, you're not getting proper nerve supply to the joints, to the organs, to the muscles, so they're not going to function optimally. So the chain of health is only as strong as each link. So your diet, rest, exercise, neurology, which is your nervous system, and mental health. You're only as strong as your weakest link. So we help you figure out where your problems lie. Maybe it's one, maybe it's two, maybe it's all five. We've had them. We've had people come in where it's just nervous system related. They eat very well, they exercise, they get plenty of rest, and they have good mental attitude. And then sometimes we get patients who come in and they may have all of these things. And you can imagine they show, and they have weight issues, they have neuropathies, they're depressed, they don't move, they don't sleep. So we start to fix one thing at a time, and we take it at the patient's base and their level. We meet them where they're at, and we start to work. If you just start exercising, that's going to improve your mental health, correct? If you exercise, it's going to also improve your nervous system, because movement is the key to life, correct? And if you just try to get to sleep at an appropriate time, but some people have issues sleeping due to some of these other things. So they all are codependent on each other. So what causes disease? Again, chemicals, so perfumes, air pollution, water pollution, cleaners, pesticides, xenoestrogens, glyphosates. Those are all known to cause disease and cancer. Physical, traumas, accidents, repetitive stress. We get a lot of construction workers here, and repetitive stresses cause a lot of issues with their spine. Vertebral subluxation complex, malalignment of bones. A spine that is aligned is a healthy spine. Spines that are misaligned, that create subluxations, will cause symptoms. So what causes disease again? Emotional. We overlook emotion all the time. And it's not that we're deficient in Prozac or antidepressants, but we are under stressful times right now. We have loss of family members, loss of a job, negative thoughts, anxieties, depression. So these are the causes for a disease. So addressing these will help you improve your health. Some of the signs and symptoms that we see and that you may have, and these are just a few: back pain, headaches, radiating pain, arm pain, leg pain, neck pain, carpal tunnel syndrome, high blood pressure. If you get radiculopathies like shooting pain, tingling, insomnia is a huge one. Many people are having difficult time sleeping right now, especially with all the stress. Decreased range of motion, that means your nervous system isn't communicating properly with your muscles. Having tight muscles is not a good thing. We all know that. Night sweats, numbness, those are just some samples of symptoms that need to be checked out. And of course, when you're doing the right thing and addressing those chains of health, these will start to subside. So some treatment options: obviously chiropractic, nutrition, exercise, rest. That should always be your first option. Unfortunately, most people go for drugs and then surgery and then come and see a chiropractor. I urge you, first chiropractic, first address your nutrition, exercise, rest, do the things that are natural first. And obviously, if needed, then we might have to take some drugs or have surgery. But we find that usually the chiropractic, addressing the spinal system, the nutrition, exercise, and if you get plenty of rest, you won't need any drugs or surgery. That seems to be what happens here. So I like this quote: if someone wishes for good health, one must first ask oneself if he or she is ready to do away with the reasons for his or her illness. Only then is it possible to help him or her. So if you're ready and willing to address some of the symptoms that you have, we can definitely help you, and you can definitely improve your health. We've seen people who are in their 80s and 90s improve their health. And I'm here to tell you that there's always something you can do to improve. Always, always. I've never seen anyone not improve. So I love this slide because, again, thoughts, traumas, and toxins, the 3 T's of disease. So in life, your health is always moving in one direction or the other. So you're always moving in the direction of death, or you're going towards health. Every single day, you want to be moving in this direction towards health, making decisions that are going to bring you this way. So obviously, exercise will bring you this way. Eating clean will bring you this way. Sleeping will bring you this way. Love, laughter will bring you this way. Managing stress will bring you this way. Anything that does not bring you this way is bringing you closer to death, and that's what we're trying to avoid. So I like to use the term dreams. It's 5 factors to health, and that's going to be diet, nutrition, rest and sleep, exercise and motion, alignment, nervous system, mental attitude, and screenings. The best medicine is prevention. If you can prevent, then you don't need to worry. That's not Charlie, by the way. It reminded me of him. So diet, nutrition. So eating to thrive, not to just survive. So dark leafy vegetables. You can eat a low glycemic diet, especially if you're a diabetic. Grass-fed beef, if you're going to have beef, you want to make sure you're getting grass-fed beef. Beef that's not grass-fed, you want to make sure that it's not loaded with hormones. Estrogen is not good for you. It can cause cancer. High doses, and they put, they inject cows to keep them producing milk, and you want to make sure that you get the cleanest kind of beef you can. We have some farms, local farms, that we get our meat products from, our dairy products. So if you're interested, just let me know and we can send you that information. Wild caught fish, not farm raised. You want to eat cage-free eggs, chicken that just get to wander, that are not soy fed. You want to drink water, plenty of water. 6 ounces per hour is what I recommend. Supplements, some of the supplements I like to just use myself, my family, and some of the go-tos, omega-3s. We have a diet that's rich in omega-6s and omega-9s. We don't get enough omega-3s, so we need to supplement with that. Vitamins and minerals, you need vitamins and minerals. Probiotics for digestion, digestive enzymes to help break down food. Flaxseed oil is another good omega-3. Antioxidants, you can do berries. CoQ10, we do labs and blood work. We find that a lot of people are deficient in CoQ10. I don't recommend you just go out and buy CoQ10. It's an expensive supplement. But if you get your blood run, if we do the labs, I always run CoQ10 to see if people are deficient. I find that probably 60% of my patients can use supplementing with CoQ10, especially if you're on a statin. Vitamin D3, of course, I would say 90, maybe 95% of my patients that I run labs on are deficient in vitamin D3. Vitamin D3 has been known to help reduce your chance of getting diseases or cancers by 50-60% if you have levels elevated in like 70 to 90. Fasting's also wonderful for your body. So not constantly eating, allowing your body to rest from digestion, from constantly working to digest food. So you can do fasting if you're in good health. If you want more information on that, please reach out to me and I can help guide you. Detoxification, removing, let me move this down a little bit for you. Detoxification, so it's important to detox. You clean your filters for your furnace at home, you clean your filters on your car, filter on your vacuum. Well, how about cleaning your body out once in a while? Because we get some toxins that build up in our system. So removing and regenerating and restoring our health. I like to detox a couple of times a year personally. I do one detox that's about 60 days, and then I do another one that's for about a month. So 3 months a year, I'll detox my body and clean it out. So rest and sleep, the average American gets about 5.5 hours of sleep per night. I think nowadays it's probably even less than that. I'm hearing from my patients they're having difficulty sleeping with all the negativity in the world going on right now. It's made it more difficult. So maybe basically turn off the television, don't watch anything negative, try to stay focused on the positive things, focus on your health as opposed to what's going on right now in the world. Research recommends 7 to 8 hours per night for adults. Obviously children require more, they're growing. Insomnia is a major risk factor leading to a shortened lifespan. Consistency is important. Recommended that you go to bed within 1 hour of the same time every night. No electronics at least 2 hours before bed. That gets you excited, and that does not allow you to fall asleep easier. Maybe reading a book is a better option. Listening to some meditative music before bed is also a great one. Limiting EMFs. We have electronics all over our homes. We have Wi-Fi. You can even shut down the Wi-Fi at night before bed. That'll help you sleep. And just limiting your electronics is going to improve it. Having some chamomile tea, just relaxing. Try to get into a relaxing meditative state before bed, and that'll help you sleep. Keep your heart healthy, exercise, obviously, reduce your stress. These are things that when you getting a good night's rest, your heart only gets to rest when you're sleeping. So that'll improve your heart, reduce stress. It may prevent cancer sleeping a decent amount of hours, because that's when your body regenerates, actually. It reduces inflammation. It makes you more alert. Bolsters your memory, helps you lose weight. Naps make you smarter. So take a nap during the day. I like to take a 20-minute nap every day. So that makes me feel better, and I come back to work feeling more rejuvenated. It also reduces your risk for depression. It helps your body make proper repairs. We all know when we don't get a decent night's rest, we're pretty foggy-headed, we are stressed, we are not focused, and we're definitely a little more crabby. So another thing I like to focus on is posture. So this is a picture of how heavy your head is. So here on this one, your head weighs normally about 12 pounds. And for every inch that you translate forward, it doubles. So here, this one is translating 2 inches. So the size of this gentleman's head is about 32 pounds. Now this one's 3 inches, it's 42 pounds. Imagine holding a bowling ball out here and having to hold it up constantly. It's gonna wear heavy on your arms and it make you fatigue. So that's what it's doing to your upper back. And sometimes we'll see Dowger's hump here from people with forward head posture. So make sure you get your posture checked. You wanna have proper alignment, because a spine that's in proper alignment is a great spine. So posture follows movement like shadow. So ultimate rigidity is rigor mortis. So our goal is to keep you here all the way to the left as opposed to here. We do get people who walk in like this, and some have come in a wheelchair and ended up leaving like that. So as long as you're willing to do the work, you can improve. Yeah, this is what we're trying to avoid. Just by looking at this gentleman, you can tell he's not healthy. So adjustments help by decreasing your pain, by decreasing headaches, decreasing neuropathies, helps you sleep better, and increases your range of motion. These are just 5 things that an adjustment helps with. As patients, you already know the other benefits of the adjustments here in our clinic. So love, laughter, and meditation. Good mental attitude is also very beneficial for your health. Love is essential for human development. Laughter increases your immune response by releasing T helper cells, endorphins, and red blood cells. Meditating just 10 minutes per day will boost your immune system. Yoga increases your flexibility and decreases your stress. Tai Chi is another great form of martial arts that helps you center your body and improve your health and your mind and connect your mind and body and spirit. Massage, acupuncture, and of course, dogs. We have an office dog here, and dogs are wonderful. Puppies are fantastic. They bring a lot of joy and unconditional love to a home. So positive mental attitude helps achieving goals and attaining success. Success achieved faster and more easily when you have a positive mental attitude. More happiness, more energy, greater inner power and strength, the ability to inspire and motivate yourself and others, fewer difficulties encountered along the way when you have a positive mental attitude, the ability to surmount any difficulty when you have an attitude of positivity. Life smiles at you when you're positive, and people respect you when you're positive, and people want to be around you. So meditation, 4, 7, 8 breaths. You can do these. You can Google it, or you can just, if we haven't discussed this with you in your care plan yet, I can review it with you when you come in next time. But 4, 7, 8 breath is just that. You take a nice, deep, slow, steady breath in through the nose, and you'll hold it for a count of 7. And then you'll breathe it out of your mouth, eliminating the CO2 very slow at a count of 8. And then you'll repeat that gently for 5 to 10 minutes a day, and that'll help slow everything down and put you in a relaxed meditative state. Yoga obviously is fantastic for that, and sleep, proper sleep. So some of the stretches and exercises we recommend for our patients, you need to move. If you don't move, you're gonna just get more rigid and have more pain. So for lower back, one of the ones we recommend is bird dog, cat camel, cobra, child's pose, and pelvic tilts. For the neck, we're going to discuss chin retractions, wall angels, postural exercises. And for core, I like the squats and the dead bugs. So if you look here, we have the chin right here, and basically you look straight forward and you just tuck your chin in. And then wall angels, you stand, you put your head to your back to the wall, and then you just bring your arms straight up. And some people are not going to be able to do that. They'll be out here, but as you practice it, you'll get better and better. And that's going to help with your posture and your shoulder range of motion. Here's the bird dog. This is a really great exercise right up here. You're going to go on all fours, and you're going to extend opposite leg, opposite arm, and keep your back straight. If you have difficulty doing this, just do your hands first, your arms first, and then do your legs by themselves. And then eventually you're going to develop that nice strong core and posterior chain, which is the back part. Okay. And it also works on the anterior chain as well. Here's your cat camels. You're just going to hunch over, pushing your belly button up to the ceiling, and then you'll dropping your belly button down and looking up. This helps move the spine. If you experience any pain or discomfort during any of these, you stop and then you have a discussion with me when you come in, or email me. Here's a great starting position for a stretch and a movement. You lay flat on your back and you put your legs up on a chair at a 90, and you imagine driving your tailbone this way and then your head driving that way, and extend your arms overhead. This is a great stretch for the low back. So sciatica, low back pain, it's wonderful for that. This here is Cobra. This helps with a lot of radiculopathy into the low back. So you start off in this position, you keep your hips down, and you come right up like that. This is a yoga pose, and you don't have to hold it. You can just go up and you can come down. If you can't get up this high, that's fine. Maybe you can only come up this high. That's okay. What you're doing is you're causing a nice curve in the low back here. Most of us don't have that curve because we sit quite a bit. So that's another great one. We will put a video together with all of these and forward it to anyone who's interested. So just shoot me an email, or Nora an email. Here we go. This one is pelvic tilt. You just lay flat on the back with your knees bent, and you just tilt your pelvis up to the ceiling. It's a slow motion, and you're just tucking your back in. And when you do that, you're giving your low back a nice little stretch. Another exercise is sitting in a chair and reaching over. And this will stretch the side motions, especially if you're sitting at a desk all day. Remember to keep your chin tucked in. Squats. So squats are super important. The reason it is because it's a motion we do all the time. We're getting up, getting down, getting in and out of a car. So a squat should look like that. You have to hinge at the hips. So pretend you're sitting back into a chair. You don't use your knees when you squat. You're using your glutes right here, your back. So you just squat back, sit back into a chair, and then come up pushing through the heels and squeeze your glutes on the way up. We do go over these with you in the office. If you need us to go over them again, just ask when you come in. Also here is one of my favorite core and pelvic floor exercises. These are called dead bugs because you lay on your back, and this one doesn't show, but your arms should be straight up, your legs both straight up, just like this, and it looks like a dead bug. And then you're gonna do opposite arm, opposite leg down. Oh, wait a minute. She doesn't have it. This one's actually, sorry, we'll send you the correct one. So it'll be opposite leg, opposite arm, go down. Okay, we'll get that corrected for you. So these are just some of the things you can do at home to improve your core and strengthen your spine. Another thing you can also add, and we will go over this with you in the clinic, but you can get a tennis ball. We have plenty of tennis balls here. Just ask me when you're in, and you can just put one right underneath your piriformis, sit on it, and stretch out the piriformis using a tennis ball. You can put the tennis ball behind your back up against the wall and strip out your upper traps, your mid traps and low traps, rhomboids, and work it all the way down to the middle of the spine and lower spine. These are just some of the things you can do at home. When you come into the office, please ask me so I can show you how to do these personally. We will try to do another video that will go through these with you. I hope this has been very helpful. If you have any questions at all, please email me at drmcparland@ihsop.com, or you can call our office 708-403-5075. And I'll be happy to answer any questions. It doesn't have to be just exercise related. It could be related to anything. If it's something I don't know, I can always get an answer for you. Thank you so much. I hope you find this very helpful. This is to better health and getting better faster. Thank you, and have a good night or good day.